Functional neurological disorder is a problem with the functioning of the nervous system and how the brain and body send and receive signals. FND Hope UK is part of the first and the only global patient-led charity for people with functional neurological disorder. Its mission is to promote awareness, support affected individuals, and advance research for the prevention, treatment, and recovery of FND.
Callum is recovering from FND, a common condition that most people, including doctors, have never heard of.
What we really need to get to a point is where people feel that they've got a legitimate diagnosis and that they're being heard.
Functional Neurological Disorder, or FND, is a problem with the functioning of the nervous system and how the brain and body send and receive signals. It can affect anyone, often without warning. When were you diagnosed and how did your symptoms manifest themselves?
So I was diagnosed in 2020, so right during the pandemic, and like so many people, my condition appeared suddenly, literally overnight. So one minute I was perfectly fine, and the next I was experiencing full body convulsions, a bit seizure-like episodes. So I was hospitalised and subsequently diagnosed with FND. Interestingly, I had actually had a similar experience the year before in 2019, but like so many people, I didn't at that point receive the right diagnosis, and it was just put down to one of those things.
Callum's experience comes as no surprise to consultant neuropsychiatrist Dr. Chris Simeon, who is also a trustee for FND Hope UK, a charity campaigning for a more consistent approach to the diagnosis and treatment of this debilitating condition.
So what we see is that it can be a bit of a whack-a-mole for some clinicians to try and work out what's going on and why, and it takes a lot longer than with other conditions. In FND, what you see is there's a problem with the signalling, so the body's ability to process information, and that leads to a dysfunction of the nervous system, hence the name FND.
The symptoms of FND can vary dramatically because any part of the nervous system can be involved. Getting a prompt diagnosis and then access to treatment can make a real difference to the recovery journey.
The fact that people have to wait a year for a diagnosis, then 2 years for treatment, means that often by the time they come to specialist centres like mine, we've seen sometimes irreversible changes to the muscles and joints.
Dr. Penny Traynor is a paediatric clinical neuropsychologist and another charity trustee. She's seen for herself what happens to children who get wrongly diagnosed and wrongly signposted.
They're not sure whether they fall into paediatrics or into child and adolescent mental health services. And in reality, that means that often people don't get any support whatsoever. So children find themselves in the middle. There's a lack of understanding and a lack of awareness in a lot of schools. Some schools try really hard but just don't know how to accommodate these difficulties, and children are finding themselves being sent home or having to spend a lot of time outside of school or outside of the classroom because people aren't sure how best to manage them. So they can find themselves quite stuck, and parents can also find themselves very stuck and really unsure where to go for help. And these are all things that FND Hope are trying to help with.
Hi there, I'm Lorraine.
The charity has won the support of TV presenter Lorraine Kelly as its charity patron, and it started lobbying Parliament to help patients and their families get their voices heard. You've been holding a series of parliamentary events this year, more planned for next year. What are the aims and objectives of those?
So our aim is to try and promote a national guideline for FND treatment and create nationally recognised care pathways, ultimately to improve recognition and diagnosis and support for individuals with FND. And we're also hoping to provide training and support for healthcare professionals.
There's a huge inequality of service provision for FND compared to other neurological conditions which have established pathways, for example, rapid access to diagnostics and treatment. People are often told that it's all in your head, is a term that we hear a lot of. There's a huge amount of stigma about FND, so I think educating colleagues, other healthcare professionals about FND is absolutely essential.
And helping to improve the prospects for FND patients like Callum.
So long term, these issues will hopefully be addressed, that there's greater awareness of FND, but In the interim, what we need to do is we need to raise awareness, and that's a big part of FND Hope UK's remit, to champion the advocacy work that we do on behalf of the community to help not only raise awareness in the general public but in healthcare professionals, because if they don't know about the condition, they can't talk about it.